The coronavirus constitutes a truly global threat. In the absence of a vaccine, our primary defense against it consists of minimizing our contacts with others in public spaces, what we refer to as social distancing. Our research team has discovered over 30,000 network cameras from all over the United States and around the world, covering many types of locations. We can utilize this network camera data to observe social distancing in a way that has never been done before at such a large scale. Researchers have studied the growth and changes in COVID-19, but don't yet have visual data to confirm that people are social distancing. Now, we have terabytes of visual data. Using this data, we can now observe people on beaches, outside of restaurants, on boardwalks and in resorts, in popular tourist destinations like Klagenfurt, Austria, or the Milan Cathedral, or in Times Square, New York. We observed over the summer that outside of protests and other deliberate public gatherings, a lot of these places that are normally full were completely deserted. We developed a method to estimate social distancing, taking into account the depth difference of bounding boxes, and we applied it to the vast and diverse camera data we obtained from these network cameras. Our method performs better than existing methods, estimating numbers of people following the guidelines and not following them. Using this method, we can see what social distancing is like all over the world, on streets, in backyards, in tourist attractions, and in parks. One interesting direction of research is taking into account groups of families traveling together. In France, most public locations reopened on May 11th. After this date, our data shows a clear increase in numbers of people seen in our cameras. Similarly, we plot the data for other countries and observe some of the trends. Great Britain's pattern is different than what we observe in most countries. We observe interesting results across the United States as well, where we have the most camera data. Where we have more data, we observe clear and more representative trends. And sometimes we're able to observe very different patterns by state, like the difference between New York and Arizona. We hope to make a difference in the fight against coronavirus, and we hope that our work will inform public health decisions in future pandemics. We'd like to thank our sponsors, the Argonne Leadership Computing Facility, which is the DOE Office of Science user facility. We thank the Argonne Leadership Computing Facility for access to the Cooley supercomputer that was used in this study. This project is supported in part by the National Science Foundation and Purdue College of Engineering Fund for Security and Privacy.